Hi everyone, welcome back to my channel and you're watching The Brown Feminist. So after a brief 2-week hiatus, I am back to YouTube for you guys. During these 2 weeks, I was a little bit busy getting married. If you want to see more updates of my lifestyle content and just my daily life, please don't forget to follow me on Instagram where I post more of my daily life and lifestyle content in general, and it's called The Brown Feminist Canada. Now, with that all gone, let's focus on today's content. So over the past month, I've actually been interviewing lots of candidates for an entry-level clinical research assistant positions. And having conducted, like I would say, 10, 20, 30 interviews in total for multiple positions, I have noticed a few things that candidates do wrong. So in this video, I will be telling you about 5 things that you might be doing wrong when you're in a job interview and how you can correct them going forward so you have the highest chance of landing that job. Without further ado, let's get into it. So number 1 is to prepare for the interview with at least terminology. Now, for a lot of entry-level positions, you're not expected to have a whole lot of experience. Now, that does not mean you cannot do your homework and have an understanding of what the job looks like. So even when I was an entry-level candidate, I applied for many roles where I hadn't actually done trial coordination, I hadn't done finance, I hadn't done a lot of electronic medical record systems that I hadn't used. However, whenever I read through the job description very carefully and I saw, oh, they're looking for this, oh, they're looking for that, the minimum I did was always Googled and learned basics about what these things are. For example, when I was trying to move into clinical trials from qualitative clinical research, I knew that I had never worked on a trial before. So how could I prepare for it? I watched so many YouTube videos, read books, did just basic Googling to understand what is a clinical trial, what are the phases, what happens, what is a regulated drug trial, who exactly does that kind of stuff in Canada or in the US, what is the role of Health Canada, what is the role of FDA, who usually reports to them, what is this pharma sponsor. So during the interview when they said, oh, have you ever worked with XYZ? I was able to say, I haven't directly worked on it because I haven't had that opportunity to. However, I do know that within a clinical trial setting, it is the job of a study monitor to come and kind of do these mini audits to make sure all the paperwork is okay. I do know that a phase 2 trial requires this. I do know that a regulated trial requires meeting not only the REB's requirements, but also Health Canada's or FDA's requirements. So by doing this little bit of research, I was able to actually answer a lot of these questions. Not every one of us will have specialized training in clinical research. Not every one of us will have a special certification or a special degree that ties in directly here. And that's the beauty of clinical research, is people from all kinds of allied biomedical sciences and health sciences professionals can come in and work here. You might be a physician, you might be a nurse, you might be a physiotherapist, you might be a health science grad, you might be a biochemistry grad. You can all come in and work here. But to have that knowledge, you don't really need to have 5 years of experience. Even with 0 experience, you can show that you have an understanding of these processes, and that makes it easy for their hiring person, the hiring manager, to go like, oh, they might not know things, but they are smart enough to pick up on this structure, this is how it's supposed to work. So if I hire this person, it's gonna be that much easier to get them, to get the ball rolling, to get them trained and just doing things super fast. Number 2, my advice is please let the interviewer lead the first half of the interview. A lot of the time, I've seen candidates become so excited, wanting to tell us about all of their experiences, but the more they're talking, they may be going in a different direction. They may be elaborating over and over again about a type of clinical research that I do not conduct in my program. So the more they keep talking and the more they keep kind of taking control of the early parts of the discussion, the further they're going away from the interest that I have in hiring them. Because I feel like, oh no, actually they're just re-elaborating how different their skills are from what we're looking for. Whereas if you let the interviewer guide the questions in the first half, by then you have picked up on what exactly they're looking for. Are they looking for somebody with more project management skills? Are they looking for somebody who can pick up softwares really fast? Are they looking for somebody who can do data entry really well? Because no matter how much you write in a job ad, you don't get a sense of what the interviewer is looking for until you let the interviewer talk in the first half. Okay, now coming to number 3 is unrelated skills. Sometimes you might be coming in from a field that's not super related. For example, even within the medical industry, you might be coming in from like an administrative field or different allied health fields where your skills are not super directly related, and that's okay. But during interviews, I have often seen participants or candidates keep elaborating on like how much they've done in those aspects that it just once again reminds me like, oh, their experiences are so different. How are they going to transition over? So yes, you should tie them back down. You should say, I have done this in the medical industry, and through these roles, I have learned this, which can be transferable, but then limit that and then elaborate more on the things that we are asking and on the things that are way more relevant to this position. So even if you have a lot of project management experience in medical industry, yes, you can mention it once and say, through my project management experience in the medical industry, I have worked with these common stakeholders like hospital management or REBs or finance and stuff. But when you keep talking and you hear the interviewer kind of focus more on technical skills or data entry skills, then forget what you came prepared with. You have to evolve and go with the interview and kind of pick up on what the interviewer is looking for and then focus on those parts. So yes, bring in what you have to the table, but if the interview is flying in a different direction, keep running with it and then go like, oh yeah, so forget my experience, let's talk about my degree. During my degree, I had these courses where I've done so much of data entry work because that's what you're looking for. Or during that volunteer role, I've actually done this much patient engagement and used an EMR. Maybe that's what you're looking for. So just because you have a strong skill and you think that might be relevant coming into the interview, it might not be relevant kind of after a certain question happens. Maybe, okay, they have a scope of it. And if you keep repeating again and again, then no, I have done management, or I have done, say, customer service, or I have done finance. But then after the first few questions, you realize that's not relevant to the interview, drop it. Number 4 is your resume. Even while doing interviews, we do go through resumes kind of live as we're matching it with what the candidate is saying. So it is important to kind of like have a resume that will match what you say. Now, a lot of the times we see that candidates have like one tiny line that says, I've completed this in clinical research, and no elaboration, whereas a lot of unrelated experiences have huge paragraphs. So this is a little confusing for us because it makes us feel as interviewers that you actually have more skills outside of our niche than inside. So when you're writing your resume, it's not just for the application to make it to the interview, it's also relevant during the interview. So focus a lot of your energy in customizing your resume for the job you're applying to. If you're applying for a hospital administration job, you would elaborate on administrative skills you have in the past. However, if you're applying for a clinical research job, you would shorten that part and you would expand on any kind of degrees, qualifications, skills, or experiences that you have within clinical research. For example, if the only time you've done clinical research work or have been exposed to it is through, say, a postgraduate diploma, then open that up. Don't just list it as a line and say, done postgraduate diploma on clinical research management. Break it down and say, done ICF, courses on this, actually done an internship under my diploma, or did some shadowing of these industries, wrote a report on this, or have a strong understanding of GCP, have a strong understanding of TCPS2, any certifications that you did under that kind of diploma, any kind of extra experience you got as a result of doing the diploma, if you had to attend workshops and seminars or shadow different people across industry and some pharma sponsors, anything you've done through that, elaborate on that, because that one line is probably why you got this interview. So like really expand on that and focus on that, because that is the most relevant to this job. So once again, resumes are not meant to be the same for every job you apply to. Depending on the kind of your role you're applying to, you are expected to customize your resume. Okay, number 5. Now this is gonna be super important for anybody who comes in from some kind of a professional background. So of course, when we work in clinical research, we interview all kinds of people. Like I said, people who've been nurses, internationally trained doctors, physiotherapists, kinesiologists, anyone really, like people who've done like masters or PhDs in like different health science or allied health science fields. So when you're coming from like a different role like that, nobody's gonna question your ability to do the clinical work. Right? If you've been, for example, an internationally trained medical doctor, nobody's going to question your ability to interact with patients, your ability to like understand medical terminology. So you don't have to elaborate on that too much. What we've seen in candidates over and over again is they do sell that a lot. However, remember that that is only bringing like one or two things to the table, which is your strong knowledge of medical information and terminology and your ability to interact with patients or work in a hospital environment. What more you want to highlight in the interview is also your ability to do research. So think back before the interview and just prepare some notes for yourself about any time during your pre-med or medical school training or postgraduate training that you may have done even like one course on research, or you may have like done some analysis or like written like some review papers, and highlight them when you're supporting the research aspect of it. Nobody is gonna question that you don't have clinical skills, but you also need to sell your research abilities and research skills as well. So anytime you've done like within your fellowship or within your residency that you had to do data collection or work with an ethics board or kind of advocate for research ethics in any way, or done some courses on research ethics or quantitative or qualitative methods, or you've done some like extra certifications or trainings, or you've actually helped recruit for some study, like think back and think anything that you might have done within your clinical career which could be even remotely related to research, and sell that as well. And then of course you are going to highlight the fact that you have knowledge of electronic medical record systems and this and that, which you must have had because you have been a clinician in the past. One other thing that you should also be selling if you're like foreign trained is like your understanding of local ethics and laws and everything, because a lot of the challenges that happen when you are internationally trained is that you may not have a lot of knowledge about what an REB is, what institutional like laws are, what regulatory laws are of whatever country you have now settled down in. For example, if you're in Canada or in the US. So even if you hadn't had an opportunity to kind of work locally, it's good to just read up on it, and then you say in your interview like, yeah, while I've practiced internationally, locally I have an understanding of how an institutional REB functions, how Health Canada's expectations are. Even if you are just educating yourself by reading a book or by going through YouTube training videos, even that is super helpful to make you look like a well-rounded candidate, of not somebody who just has the clinical knowledge but is also equipped to do a research role. So that's all for today's video. I hope you found it very useful. I will be coming back next week with more content. If you have more questions and concerns and have ideas of what more information I should bring to you guys, don't forget to write it down in the comment section below. Until next time, this is the Bram Feminist. Bye.